To one and all here. Yes, today it's a very special occasion. Uh, this hospital was founded by Shri B. Nagireddy Garu 52 years back, and we're celebrating a 52nd year in 1972. It was just a 30-bedded hospital. Today it's grown to a 650-bedded hospital, and we have more than 100 ICU beds. And we know that I think his vision was service to the society at affordable cost. We know that patient care and for us, our vision is patient care and patient safety. So when this, and of course we are NABH and NABL accredited hospital. We got accreditation in 2009, and we also have a very big educational academy and a nursing college with 100 students in intake every year. So it's a very big campus, and definitely today the patient emergency services have to be looked into, and with the small fleet which we have of ambulances, which is not very affordable in a trust hospital, we thought we would tie up with the RED.Health ambulance services. And I happened to meet Prabdeep Singh in one of the conferences, and I was very impressed that why he brought this in the concept of this ambulance, because I believe his father was not well and he needed emergency services, and it was not possible immediately at that time. So I think that he had a seed in his mind that he had to develop it whenever he would. I think he was abroad at that time. So when he came back, I think this whole thing got nurtured into this. And the best part is that they have a central command where they pick up every emergency call. There is not one call which is missed by them. So I think that is what all attenders of patients will be looking at, because if I am in that place, I would want someone to come to me within 2 minutes or 3 minutes, which is what they are trying to do, I think. And the other thing is that they are covering most of India. I think most of the cities have been covered, and a lot of big hospitals have tied up with them. So, and for them, this is the first launch in Chennai with the Vijaya Group of Hospitals, and I wish them all the best. Thank you.
Moment for all of us to launch in Chennai market, and like ma'am rightly said, that launching in Chennai with Vijaya Group of Hospitals, I think it's a pride which we will always take care, and we will feel proud even after 50 years from now that we have actually launched Chennai market with the partnership of Vijaya Group of Hospitals. In fact, I was just telling ma'am that this campus overall is such a beautiful campus. I've been into healthcare for almost 9 years, visited so many hospitals, but this is probably one of the hospitals when you enter and you get such positive vibes that you will automatically start healing yourself. I think that is very, very well made, and thank you so much everyone. I'm actually also representing Mr. Prabdeep Singh, who is the founder. Actually, he was supposed to be here, and ma'am rightly said that what was the vision of being launching this emergency response company in India. So we're the fastest and the largest. We're there in more than 550 cities in India. But then what ma'am rightly said was, we are actually there where when we talk about in healthcare, the first 1 hour is the golden hour, and that's the time when the need or the primary health can be assisted at the home, and bring the patient to the hospital at the real time is where we pitch in. And we're very proud that we're launching with Vijaya Hospital today. It's a very proud moment. We are actually making the whole emergency integrated with the call center and also with the ambulances. Thank you so much, and all the very best to everyone. Thank you.
Good afternoon all, members of the press and all the dignitaries on the dais. Shalabha has already told, we're already present in more than 20 cities working with hospitals, and our services are available at 550 cities. But Chennai was one city which we wanted to start, and what better opportunity than Vijaya Group of Hospitals. I still remember, ma'am, our discussion over a Zoom call where you both had multiple questions. I was so happy that people were asking questions to us. So we are happy to be partnered with Vijaya Group of Hospitals and launch our first hospital in the city. We are emergency response system where everything is a tech enabled, while right from answering the calls, triaging over the calls, sending an ambulance, whether it's a hospital owned ambulance or our own ambulance, it's a network of ambulances anywhere in the city. We can send the ambulance within 15 minutes. The idea was pretty much appreciated by Vijaya Group of Hospitals, and we are here partnering with Vijaya Group of Hospitals, and we would love to work with you along with for long years, ma'am. Thank you so much, and thank you all of you to be here in this sunny conditions. Thank you so much.
Good afternoon, one and all. Tamil பேசலாம்ங்களா? Become easy for all. இப்போ நீங்க ஹாஸ்பிட்டல்ல வந்து எனி ஹாஸ்பிட்டல் எடுத்தீங்கன்னா எமர்ஜென்சி சர்வீஸ் சொல்லுவாங்க பாத்தீங்களா? ஷலாப் சார் சொல்லிட்டாரு. எமர்ஜென்சி சர்வீஸ் a core service. So when a person calls a hospital expecting ஒரு voice of reassurance, நாங்க அனுப்புறோம் ஆம்புலன்ஸ், கவலைப்படாதீங்க 10 நிமிஷத்துல வந்து சேர்ந்துரும். ஏன்னா அந்த கோல்டன் ஹவர்னு சொல்லுவாங்க. அந்த கோல்டன் ஹவர்ல அந்த பேஷண்ட் வந்து ஹாஸ்பிட்டல் சேரணும். இட்ஸ் வெரி வெரி இம்பார்ட்டன்ட். அப்பதான் எங்களாலையும் சரி அந்த லைஃபை சேவ் பண்ண முடியும். இப்போ எனி ஹாஸ்பிட்டல் will only have a limited ambulance fleet. 4 இருக்கட்டும் 5 இருக்கட்டும். பட் ஈவன் தென் இப்போ இருக்கிற சூழ்நிலையில there's a demand, increase in demand of emergency services. அது வந்து எங்களால வந்து I don't think we will be able to do justice. இப்போ எங்கிட்ட 4 ஆம்புலன்ஸ் இருக்கு, 5வது ஒரு கால் வரும்போது 4 வெளில போயிடுச்சுன்னு வச்சுக்கோங்களேன், அந்த 5வது பேஷண்ட்டுக்கு எங்களால டிலே தான் பண்ண முடியும். we cannot do justice. So இந்த மாதிரி சூழ்நிலை தான் Red Ambulance is coming to partner with us. The aim of this collaboration with Red Ambulance is to make sure that anybody who calls Vijaya Hospital saying எங்களுக்கு ஆம்புலன்ஸ் வேணும், நாங்கள் உங்கள் ஹாஸ்பிட்டல் வரணும், எங்கள் லைஃப்பை சேவ் பண்ணுங்கன்னா, we will never say no to anybody. We are going to make sure that they reach in the golden hour and we can save lives. And this is the core concept, and this is also in line with our motto of the organization, where it is selfless service for a healthy society. So hopefully this collaboration will take the entire emergency services to the next level, and I'm hoping that it will be a win-win situation for everybody, hospital, Red Ambulance and the community. So thank you very much.